morning to everyone. And yes, today we'll be talking about depression and anxiety. These are two conditions and diseases, if you will, that are very common, very important, and very near and dear to my heart. In my career, I saw so many patients, and still do, with these symptoms and problems, and there is so much that can be done, and so many people suffer in silence and don't get proper treatment, and it is so easily available and so beneficial to everyone who seeks that treatment. We'll talk about how to make all that happen in just a few moments. I did practice for many years, 31 years in a suburb of Dallas, Texas, and now have moved to Charlottesville, Virginia, where I went to medical school, and I see patients here some, and still take a great interest in depression and anxiety. So before we get started, I want to offer you and pose one question that we'll call a quick survey poll. And this question is, and you'll have an opportunity to answer it, as you can see on the screen, do you know anyone who could use help for potential depression or anxiety? Okay, well, let's talk first about depression, and then we'll get into anxiety. They do overlap, and they do interconnect, and they do affect each other. But depression, what is it? Well, it is a mood disorder. There's no secret to that. It has two primary symptoms, sadness and loss of interest. Sadness, happiness, feeling hopeless, and then the loss of interest in normal activities that you used to enjoy. If you have those two symptoms, then depression is high on the list for your diagnosis. This affects your thinking, your feelings, and your behavior, and it affects all the people around you, your family, your coworkers, and your friends. And this is why it's such an important disease. It can have such an adverse effect on your relationships and your function in life, yet there's so much that can be done to make that better. And so how common is depression? It's very common. One study showed that there were 14.8 million Americans who experience depression in any given year, and that's about 6.7% of the population. Now, I think that number is low because a lot of people don't seek treatment, and therefore their numbers don't show up in these statistics. In my experience, these numbers would be higher, so it's a very common disease. And throughout one's lifetime, the likelihood that you'll have a depression is more than the likelihood that you won't in most cases, whether it be a depression based on some loss you've had, a loss of a loved one, a divorce, a job loss, or some unknown reason that depression just came from the inside out. We'll talk about those causes in just a moment. The women are 70% more likely to have a depression than men. There are reasons for that. Some of it's hormonal, some of it's just neurotransmitters in the brain, and some of it's the stress and the cultural requirements that are put on women, which, as a man, I can say this pretty surely, you're asked to do more than we are, and you do more than we do. That puts a lot of stress on you, and that can change the chemistry in your body, that can change the chemistry in your brain and affect the neurotransmitters, and depression and anxiety can ensue. Women are misdiagnosed 20 to 50% of the time. Isn't that horrible? I mean, they go to the doctor's office, they have fatigue, they have headaches, they have bowel problems, or nervousness and sleeplessness. Well, these are symptoms of depression that we'll get to in just a moment, but often they're just diagnosed with insomnia, treated with sleeping pills, or just weakness and fatigue, anemia, whatever, but a misdiagnosis is common, and it just should not happen, not nearly to the extent that it does. And again, it is an underreported. Both of these illnesses are underreported, especially depression, because depression is on a continuum. There can be small, medium, and large. And these are distinctions that we'll have to make as we talk through this disease. So what are the causes? There are 5. First of all, heredity, genetics. If you have a family member who has had depression or bipolar disorder or even post-traumatic stress disorder and these kinds of mental problems, you are more likely than other people to have depression also. Now, these genetics can help the genetic aspect of depression and to a lesser extent, but still a factor in anxiety, it can work for us in the following way. As we have mapped the human genome, we are able to now, and will be able to more so in the future, determine who is going to be more prone to depression. And if you, as a person genetically tested, are going to be prone to have a depression, then you can take proactive steps to help recognize it early, or prevent it perhaps, and certainly get treatment early. Also, the genetics and the human genome mapping will help us learn how to treat you properly. Right now, the treatment is medication treatment. We often have to choose one of many different drugs and hope that it works and take an educated guess as a physician that it's the right medication for you. Now, sometimes that's not the right medicine. You have to switch around. And the genetic testing, I think, as the future goes on, and not too distant future, I'm talking in the next year or 3 years, we'll be able to sort of dial in and say, hey, this is the most likely class of medication that would help this particular person who's had his or her gene mapping done. The second cause after genetics would be life circumstances, just what happens being a human being in life, and especially being a woman with the demands that are put upon you. The circumstances that cause stress and worry, and these things can feed in and be part of, if not the entire cause of your depression. Thirdly, there are chemical changes. Now, these are on a genetic basis, we think, but also can be affected by things in the world that we don't understand yet. But chemical changes in the neurotransmitters in your brain. There's basically three of them: dopamine, serotonin, and norepinephrine. And these can become imbalanced and improperly working in the brain, and that can be a sole cause of depression and anxiety, or one factor of many. Fourthly is hormonal changes, especially in women, of course. This can happen both at the beginning of your reproductive years, at the end of your reproductive years, and basically any time. The fluctuations in hormones for women is, of course, is far greater and far more regular and troubling than in men. And this feeds into depression as well as anxiety. And then lastly, there are certain diseases that can look like depression and actually masquerade as depression. For example, low thyroid, anemia, and some other diseases. Now, these are uncommon causes and uncommon contributing factors to depression, but they need to be evaluated. They need to be watched for, and they need to be investigated before you start treatment, just to make sure that they aren't present. Now, depression differs from simple sadness, and anxiety differs from simple stress. And here's how. Sadness is something that comes and goes. It may be here one day and not another. It may be here for a couple of weeks and then nothing for a couple of weeks. When you have depression, generally that sadness is more persistent every day and lasts longer, maybe for 6 weeks, 8 weeks, 12 weeks, or longer. So it has to do with the frequency, somewhat the severity, and how long, the duration of the symptoms that you have. That sort of separates simple, regular, day-to-day sadness from depression that is a chemical disorder that needs treatment. There are other disorders that are related to and have depression as part of them, and these need to be investigated by your physician also, like bipolar disorder, post-traumatic stress disorder, cyclothymia, which is where your moods cycle back and forth, but not in such a great fashion to label you as bipolar. Dysthymia, which is sort of low-grade sadness. I think you call dysthymia, starts with a D, D-Y-S-T-H-Y-M-I-A. Dysthymia has to do with sort of a low-grade sadness. It's probably more of a mild depression, sharing many of the chemical characteristics of a major depression. And then premenstrual dysphoric disorder, which used to be called premenstrual syndrome, as well as the effects of certain drugs. Some medications can cause symptoms that look exactly like depression, and they can cause depression. So these are things you need to talk with your doctor about. Now, there are two basic questions. There are two questions that you must ask yourself or ask anyone that can help you really screen for depression. And these questions are: in the past month, have you been troubled by feeling down, depressed, or hopeless? And secondly, in the past month, have you experienced little interest or pleasure in doing things? Now, if the answer to both of those questions is no, then there's a 90% chance that you do not have a depression as the cause of your symptoms. Still a 10% chance, statistically speaking. If the answer to either one of those questions is yes, then there's a 68% chance, if you go by certain studies, that you may have depression, and you need further testing to evaluate the existence of depression or the non-existence of depression in you as a particular unique patient. There are two scales that I've used in my career to diagnose depression, and these are things that you can use find online and are easy to take. There's the Beck Depression Inventory, BECK, the Beck Depression Inventory. This is, I think, a 20-question questionnaire, and you can self-score that to decide and be told or be informed as to whether you have a depression, and if so, how severe. And then there's the Hamilton scale. There are several of those, but the Hamilton scale is easily found on the internet, and it too can be self-scored, but that particular scale is usually better scored by a clinician, somebody in the medical field. So let's talk now about the symptoms of depression. You know, what really draws one's attention to depression. Well, some are obvious and some aren't. Sadness, tearfulness, emptiness, and hopelessness. Now, we all experience that intermittently through our lives with certain things that may happen. But again, if this is something that happens more days than not, for more than a few weeks, and it affects the function of your life and your relationships, then it's a symptom of depression. So sadness, tearfulness, emptiness, and hopelessness. The loss of interest in things that used to interest you. This is called anhedonia. A-N-H-E-D-O-N-I-A. That's a big word for the loss of interest in the things that used to get you charged up, whether that be sports, hobbies, sex, vacation, whatever. These things just seem blah to you, and that's a major sign of depression. Fatigue. There are lots of causes for fatigue, some benign and some not so benign, but fatigue is a symptom of depression. Slow thinking, poor concentration, slow motion. There's something called psychomotor retardation, and that's where your brain is functioning in such a slow and depressed fashion that your emotions are slow and depressed. Your walking, your work habits show a slowness to them in the use of your muscles and your joints and your arms and your legs. You may sleep too much or you may sleep too little, and that varies from person to person, but both extremes can be a symptom of depression. Same thing with appetite. Your appetite may go up, your appetite may go down, and your weight may go up, and your weight may go down. Any extreme like that from one end of the spectrum, from one end of it to the other, may indicate depression, and certainly is a symptom. Unexplained physical symptoms, and this is one of the reasons that women are often misdiagnosed, and it's not good, because many women, and men for that matter, will be seen by their doctors over and over again for things like low back pain, that's persistent, chronic joint pain, headaches. These can be, if unexplained and found to be not related to anything structural or anatomic, these can be a sign or a symptom of depression. Withdrawal from activities and relationships. This has to do some with that anhedonia that we spoke about, but this is where you don't go places you used to go, you withdraw from things that you used to take an added interest in, and including relationships. Anger. This is more common in men as a symptom of depression in women, but it does occur in women. Restlessness, where you just can't seem to unfidget yourself. Guilty feelings. If you have feelings of guilt and low self-esteem, this is a real important symptom of depression, and it's very common. It's the rare person with depression who does not have some guilt feelings, unfounded usually, and self-esteem issues. It's hard to know which causes which, and there's probably sort of a bimodal effect where one affects the other. So let's talk now a little bit about treatment of depression. You know, one of my most frustrating parts of my career has been the patients that either won't seek treatment when I know it will help them, or they even admit that, and know that they have depression, but refuse treatment because they're fearful of side effects or whatever else might cause, might come from their treatment. And it's just frustrating because there's so much that can be done. Just prior, though, to getting into these treatment aspects of this disease, I'd like to offer a second quick survey poll with the following question. What is your biggest concern about getting treatment for depression? And you can see the choices, and please make your choice. I'll give you about 5 to 10 seconds there, too. I think we're a fast-thinking group, perhaps. Okay, so let's get into treatment a little more heavily here. Now, there are things you can do without a doctor, and there are things you need a physician to help you with, or a healthcare professional of some sort, nurse practitioner, anyone in the medical field. First of all, the things that you can do. Exercise. Exercise is an incredibly effective means to fight depression. It makes everyone feel better by virtue of the hormone, the chemicals we've heard about called endorphins, but it also affects your body's cortisol level, your adrenaline levels, and key to any form of treatment for depression is exercise. And it has to be good aerobic exercise, a minimum of 3 times a week, 30 minutes per time, and to get your heart rate up to a certain level that is usually pinned at 80% of 220 minus your age. So 220 minus your age multiplied by 80%. This should be where your pulse rate should be kept for 30 minutes, at least 3 times a week, to have the minimum good effect on your body from the exercise, both cardiovascular as well as mentally. Self-help groups. There are many of these. They're all over the internet, and you can dial in depression or sadness or fatigue or insomnia, and you'll get plenty of opportunities to elicit help. There's something called the National Alliance on Mental Health, and I would urge you to seek that website, the National Alliance on Mental Health. Counseling is so important, getting some sort of therapy. Now, it's not essential, and you don't have to have it, but studies have shown over and over again that it is very important for most people to have some form of counseling to help make their depression better. And the same thing holds for anxiety. Now, a psychiatrist is going to be able to prescribe medication for you, but a psychologist is going to be more involved in psychological therapy and counseling. Also, you can use a counselor. Their initials are usually LCSW, Licensed Counselor and Social Worker, I believe that stands for. A church contact, it's your minister, your priest, your rabbi. Also, you can use your family doctor, perhaps, or one of the healthcare professionals that you see as your primary care physician or healthcare provider. They often are well trained in how to help you with therapy to help your depression improve. This type of therapy, I'd like to read you some of the things that this therapy can do and help you cope with. First of all, it can help you adjust to a crisis. It can identify negative beliefs and behaviors and replace them with healthy, positive beliefs. You can develop positive interactions with others, find better ways to cope and solve problems, identify issues that contribute to your depression and change behaviors that make it worse. You can regain a sense of satisfaction and control in your life and help ease your depression symptoms. And you can learn to set realistic goals for your life and develop the ability to tolerate and accept distress using healthier behaviors. Mindfulness is a big thing. It's been very important in the medical literature over the past few years regarding how effective mindfulness therapy can be. It's sort of a form of meditation that has you living in the now. So I would urge you to look into mindfulness. Tai Chi and yoga and any form of meditation has been shown over and over again to improve the function of people with depression and to help medications work better. Music and art therapy is helpful. Spirituality may help you if you're bent in that direction, and this can be facilitated again by your minister, your priest, your rabbi, anyone associated with your church. Now, there are many medications that can help your depression, and I'm a real proponent of these medications for those patients who do not respond to the methods we've already mentioned. Or for someone who has a severe enough depression that you really want to jump on this thing quickly. Or I have seen these medicines do such good for so many people. There are 3 or 4 major classes. There's the SSRI. These are things like Prozac and Zoloft and Celexa. There's the SNRI. These are things like Cymbalta, Effexor, and Prestige. And the NDRIs, which is Wellbutrin. Now, these 3 different types of drugs affect the 3 different chemicals: serotonin, norepinephrine, and dopamine. There are other atypical medications, something called Remeron, Trintellix, Vibrid. There's a whole lot out there. They are good for people who can't tolerate side effects or have problems with the other drugs that we just mentioned. Sometimes you'll need a combination treatment. You'll need maybe a small dose from one class, or a dosage reduction in one drug from one class, along with a smaller dose from another drug in another class. This will depend upon how you respond and your physician's approach to your condition. There are ways to augment your treatment. For example, some people will respond better to an antidepressant when they have a very low dose of Ritalin, for example, for ADD type symptoms, or some thyroid hormones help that. But these are sort of not the most common treatment, and we're not often needed, but if needed in a very depression-resistant situation, they can help a lot. Now, if you do have problems with these medications, and this is a real fear that people have, side effects. I mean, the side effects can be sexual dysfunction, fatigue, drowsiness, nausea. These are not common, but they can be troublesome, and they're very easy to approach or to make better. For example, if you do have certain side effects, you can reduce the doctor can reduce your dosage of the medication, or change you completely to a completely different medication, or you can take 2 medications in small doses so that you minimize the side effects from either drug, but maximize the benefits as they work together in synergy. For further resistant cases of depression, there is new data that is more supportive of electroconvulsive therapy. This is what you saw in One Flew Over the Cuckoo's Nest with Jack Nicholson. It went out of favor for many years, but it's come back for people that really need it and don't respond to other treatments. And then there are transcutaneous, that's through the skin, magnets that go on the head and the neck and behind the ear. And these are coming into some favor and may help a lot. I think the next few years will tell us a lot more about that treatment. So how long do you want to have your depression treated? How long would it need to be treated? A lot of people don't want to get treated for depression with antidepressants because they're fearful that they will be hooked on the medication or have to stay on these medications for the rest of their lives. And that is just not true. You will not have to stay on these medicines for the rest of your life in all likelihood, unless you're just one of these people with recurrent and persistent depression, in which case I would tell you those patients that I had like that welcomed being on the medication their whole life and wanted it because it made them feel so much better. But in general, if you have a response to a medication, to an antidepressant, you want to stay on that medication at the full dose that got your good response for 9 good months. After 9 months of feeling very good emotionally and depression-wise, then it's safe to slowly taper the drugs in most people. Now, in more severe depressions, and especially if there's suicidal thoughts and this kind of thing, we would probably go to 12 months, maybe 15 months. But in general, 9 months for your average and medium-level depressive disorder. Now, if you relapse at that 9-month period, then it's probably a good idea to go back on the medicine for twice that time, 18 months. And some studies say if that happens again, you double that. That's very personal decision that goes along with you based on your symptoms and your progress, and based on your medication mixture, as well as your physician's experience and comfort level with treating you with the medications long-term or short-term or medium-term. Now, there are 2 more aspects of depression that we'll talk about, and then we'll hurry on to anxiety because we're running low on time here. First of all, if you do have suicidal thoughts and this is a very common aspect of depression. There is a hotline called 800-273-TALK, 800-273-TALK in the U.S. This is the National Suicide Prevention Lifeline. And one final comment on depression is alcohol is not an antidepressant. A lot of people treat their depression or their depression symptoms with alcohol, and it does make them feel better temporarily because they sort of get away from their problems. But alcohol has been shown that as a chemical, it is a depressant, not an antidepressant. So it's sort of like throwing gasoline on a fire, a little bit at a time. I'd watch the alcohol with the depression. Okay, so let's move to anxiety now. Anxiety, again, is very similar to depression. It is a normal emotion, and we often get it, of course. Life has its problems, but it's not always a normal emotion, especially when it becomes persistent and gets in the way of your function with the people around you. It does reduce the effectiveness and the happiness of your personal interactions and your social functions both at home and at work. And there are really 4 types of anxiety. The fourth one is the most common, so I'll list the first 3 quickly. Panic disorder. This is where people, maybe in crowds or when they're driving over bridges, they get sweaty, chest pain, palpitations, and choking. Very uncomfortable feeling, and they often have to leave places that they're at. And panic disorder can be effectively treated, but it's a difficult problem. Social anxiety disorder. This is a self-conscious feeling where you are sort of fixated that others in the room are going to be judging you or ridiculing you, and you feel sort of automatically embarrassed. I think we've all felt that a little bit, but if it's more than just a little bit, it could be a true problem that you have. The third anxiety disorder is phobias, and we've all heard about these, the phobia, being afraid of heights, high speeds, spiders and snakes. I think that's relatively normal, but there are phobias that do occur along those lines that are sort of severe. And then the most common is what's called generalized anxiety disorder, GAD, generalized anxiety disorder. This is the most common, and this is an excessive, unrealistic worrying and tension feeling with little or no reason. It's a very common disorder. A lot of people just suffer through it, just like they do with depression, and there are effective ways to treat this. First of all, the treatment entails exercise again for the endorphins that come out, reduce caffeine and soda pop that has caffeine in it, like it's not just coffee, it's soda pop and energy drinks. Get good sleep. Stage 4 sleep is when you do conflict resolution. We all have conflicts through our life, and during our days. And when you go to sleep and you get into stage 4 sleep, you have conflict resolution. Now, if you don't spend enough time in stage 4 because you have restless sleep, or you don't spend enough, you don't go through enough cycles of stage 4, and because you say only get 6 hours of sleep instead of 8, then you're going to have poor conflict resolution, and that moves you into depression and anxiety type symptoms. There are self-help groups. The National Alliance on Mental Health has a good website that you can get involved with anxiety treatment there. Counseling, again, psychologists can help you with counseling, licensed counselors and social workers, church contacts. Your primary care physician can help you also. Mindfulness, Tai Chi, and yoga, just as we spoke about with depression, is very helpful with anxiety, and it's shown over and over in studies that it is helpful. It doesn't seem to be quite as helpful for anxiety as depression, but definitely makes a difference. Medications. Medications can be a problem in anxiety because some of them are habit forming. For example, alprazolam and clonazepam. They are wonderful, treated on a short-term basis for anxiety. Over the long term, they can be a little bit habit forming, but if you use low doses and even regularly use low doses, sometimes that can help a person with persistent and severe anxiety who doesn't respond to other medications. Now, some of the antidepressants also will help with depression, and with anxiety. Some of the antidepressants like Prozac and Zoloft, etc., can have the same chemical beneficial effects on the brain when people have just simple anxiety instead of depression. Side effects of these medications are the same as we spoke about with depression. The alprazolam and clonazepam can make you a little sleepy, but that's not too bad. But you've got to be careful with them if you're going to be driving. And cognitive behavioral therapy is another go-to therapy that people can get from their psychologist for their anxiety. And finally, again, just a reminder, reduce caffeine. Caffeine does help you get up and get going and get moving, but it does feed into anxiety. And finally, will treatment help you? And that is a resounding yes for both of these diagnoses. It does wonderful things if you'll just stick with it and try your best to get on something that helps you. And I hope this talk has helped you. I hope it's broken down some barriers on ways that you can help diagnose yourself or be diagnosed, broken down barriers to seeking treatment and taking treatment and putting up with some of the side effects that may be less severe than the bad things that happen from depression and anxiety. Now, if you have any questions, we'll have a question segment in just a little bit, and I hope, again, that this has been helpful, and if you are feeling any of these symptoms that we spoke about, please get treatment. It's a really good thing to do.